In today's busy clinical environments, it can be a struggle to find time for teaching. But what if I told you there are evidence-backed strategies for enhancing your clinical teaching that could take less than 5 minutes to implement? Hi, I'm Amy Gardner, Associate Dean for Faculty Development and Director of the Academy of Medical Educators here at the University of Colorado School of Medicine. Hear from Dr. Chris Hoyte, Professor of Emergency Medicine here at the University of Colorado School of Medicine, and learn his tips for enhancing your teaching in busy clinical settings.
So here's the age-old question for those of us clinical educators. How do we ensure educational effectiveness while simultaneously providing high-quality, cost-effective care? Is this even possible, or must there be a trade-off? Hi, I'm Chris Hoyte, Professor and Vice Chair of Academic Affairs in the Department of Emergency Medicine here at the University of Colorado School of Medicine. And I've been teaching in the clinical arena for 15 years. I'm here to tell you, yes, it is possible to provide effective educational experiences in a busy clinical setting. Let me introduce you to a 5-step approach that you can incorporate into your teaching encounters in 5 minutes or less. So let's jump into each. First, get a commitment. Early into a consultation, encourage your learner to make a commitment to a diagnosis, a workup, or therapeutic plan. Ensure the learner feels responsible for patient care and can enjoy a more collaborative role in problem solving. Prompts such as, what do you think is going on with this patient? What laboratory tests do you feel are indicated? What would you like to accomplish on this visit? Can all help you assess the learner's needs and get the problem-solving process rolling. Another teaching tool is to probe for supporting evidence. Ask the learner what evidence supports their commitment, what other choices they considered, and what evidence supports or refutes those alternatives. Ask questions such as, what were the major findings that led to your diagnosis? Why did you choose that particular medication given the availability of many others? And what else did you consider? These prompts can help you identify prime teaching points for subsequent instruction. Another tip is to teach general rules. Instruction is more memorable and more transferable to other cases when it is offered as a general rule. Try to avoid anecdotes and idiosyncratic preferences to make a lasting impact. Also, be sure to reinforce what was done right. Positive feedback helps firmly establish desired competencies and can help build learner self-esteem. Instead of offering general praise like, you did a good job, focus on specific behaviors that the learner can repeat consciously and emphasize the positive impact the action has had. And finally, correct mistakes. Choose a calm, private setting when possible and start by first asking the learner their perception of their own performance. If they are aware that there was a problem, this provides a streamlined opportunity to acknowledge it and begin discussing recommendations for improvement. If the learner is unaware of an error, discuss what went wrong and the potential negative consequences of the event. Always focus on how to correct and avoid mistakes in the future. I have found that this 5-step approach is an extremely practical clinical teaching model that can be easily applied in 5 minutes or less. By incorporating these tips, getting a commitment, probing for supporting evidence, teaching general rules, reinforcing what was done right, and correcting mistakes, you will be on your way to time-efficient and effective teaching.